It's not a number we should be comfortable with. That's the message from the BC Coroner's Service as again for the 7th month in a row, more than 100 people in the province died from illicit drug overdoses.
Each of those numbers represents a family that's lost a loved one.
There were 127 suspected illicit drug toxicity deaths in September. That's equivalent to more than 4 deaths a day.
It is a little bit lower than what we were seeing in the summer, where we saw some very, very high numbers of people dying. It may be that with the lessening of some of the social distancing restrictions, people are more able to access some of the harm reduction services that were really restricted before.
So far this year, 56% of the people who died of an overdose in the province were in their own home at the time.
Often they are using alone and they are dying alone. That's a huge risk factor.
I think of 127 families who are in heartbreak forever. I think that we are, as a province, not doing a good job to mitigate these numbers.
6 years ago, Leslie McBain lost her only child to an overdose. Her son, Jordan Miller, became addicted to the pain medication oxycodone and died at just 25 years old. Since his death, McBain co-founded Moms Stop the Harm in order to educate and end the stigma, which she says causes many people to hide their addiction and use alone.
People who use drugs are regular people, and certainly in our membership, our families are totally diverse across the board of socioeconomic status, in regions and housing, everything that we have in our country. Those represent the people who are using drugs.
If the numbers of people dying continue as they have been this year, 2020 will be the worst year ever for this province in terms of loss of life due to drug toxicity.
The BC Coroner's Service predicts the province will see nearly 1,600 overdose deaths by the end of 2020. In Vancouver, Ashley Burr, City News.